Good afternoon. Scott McMahon, Director of Metro Communications. Metro Communications is a 911 public safety answering point for law enforcement, fire, emergency medical services, and emergency management in Minnehaha County. Our team of 911 operators are often the first contact during an emergency event. Our mission is to provide community service, quality service, maintain professional standards while enhancing the life and safety of our community by serving as the lifeline between the public and the first responders. Our team has received special instructions pertaining to information gathering related to the COVID-19. We have initiated a screening tool to assist us in information gathering for all non-trauma events. Here are the changes that we've recently implemented. Our team will ask callers if the patient has experienced new or different shortness of breath with a fever or persistent cough. In addition, our team will also ask the patient if they've had contact with someone with flu-like symptoms recently. Last, our team will also screen the patient for recent travel history. The information that Metro Communications gathers is critical to the prevention of protecting emergency responders from COVID-19 so that our team can remain healthy and ready to respond to the public. 911 should always be contacted for emergencies and public safety needs. For information specific to COVID-19, please contact covid.sd.gov or 1-800-997-2880 for the South Dakota COVID-19 information line. As always, if you feel like you have a non-emergent symptom, please call your healthcare provider for guidance. Thank you.
Hi, good afternoon. Lieutenant John Toom with the Sioux Falls Police Department. And our department has looked for ways to change how we handle some calls. The objective is to limit the amount of person-to-person contact we're having, to help slow the transmission of any diseases and also protect our first responders. It's something that we all collectively have to get behind if we're gonna have good results. One of the ways we're working to some changes, since 2012 we've offered online reporting, and now with a press release this morning our chief has put out, we're going to now mandate certain calls be given that online reporting option, and those are listed. 6 different report type calls we have are harassing phone calls, lost property, theft, vandalism, vehicle vandalism, and thefts from vehicles. So that now will be offered as an online reporting option. If it isn't possible for that person to make an online report, they will be added to a phone report section, and then officers will get with them as time allows to make that phone report. This just minimizes our person-to-person contact we have on a daily basis and helps protect our first responders. Like many departments across the country, we're taking steps to limit the spread of COVID-19. And by making a few changes locally, we hope to impact that, keep the public safe, our officers safe, and still provide a high level of service. First responders are a finite resource, and we need to do everything we can to protect those responders, but we also need to perform our function to the community, and the community can help in many ways by just notifying us of any issues that you have up front and understand the constraints on our time and what we need to do to keep a safe distance. Services may not be like what you're used to seeing, but they will still be the same quality and will still serve the residents of Sioux Falls on a day-to-day basis.
The emergency medical system as a whole continues to stay committed to providing high-level EMS care to the community. In order to do that, that takes our human resources make that happen. So in order to do that, we got to continue to protect our human resources. So we've implemented a couple things. Number one, the call taking process through Metro Communications, gathering that information from the caller on if there's any suspected flu-like symptoms, any suspected positive testing or known positive tests, or any other information that's relevant to the call as far as that could transmit to a responder. That way we can also utilize personal protective equipment. So when you see our personnel on calls where we have patients that with flu-like symptoms or suspected symptoms, you're going to see our people in full PPE. They're going to have safety glasses, they're going to have N95 masks on, and they're obviously going to have gloves on like they do on every other call that they go on. That's the way that we can help protect our responders, but that starts with the information gathered from 911. And then beyond that, we are going to probably ask the patient to put on a mask. We'll provide a mask, a surgical mask for the patient to put it on, and that's one of the things that we can do to help control the expiration of the patient, to keep it from getting close to the responders, and then we'll also protect ourselves as well. So those are a couple of things that we're putting in place for our personnel to help keep them safe, along with all the other CDC recommendations, social distancing, and all the other recommendations that they have provided, and they continue to provide and send out updates daily that we brief at in the afternoon among all the partners in this room to make sure we're making the best decisions and putting forth the best system that we can. I do want to bring up Mike Bureau from Patient Care Logistics Solutions to have him talk a little bit about the transport side of things.
Certainly. Good afternoon, everyone. So to begin, in addition to our normal ambulance-accredited cleaning processes that we normally use, we are also adhering to the CDC recommendations that were released approximately 2 weeks ago. On top of that, we continue to adjust and monitor our PPE stock and our stocking processes to ensure that we have the appropriate CDC-recommended equipment available to protect our patients, our employees, and our community partners as we move forward. In addition to those messages were provided by my community partners, we'd also like to strongly urge the public to notify responders upon their time of arrival or upon placing a call to 911. If someone you live with has been identified with COVID-19 as a positive identification, or if you've had recent contact with somebody who has been positively identified with COVID-19. We'd also like to reiterate that as a team, we are all working together to follow and adhere to the CDC best practices as they have been given out here in this fluid situation.